One thing that we found that with COVID-19, it really forced everyone to kind of rethink how they receive and deliver their training and education. So it was a real move our cheese moment, but in the end, I think we all came out stronger and we became more flexible of really kind of understanding how distance learning opportunities will benefit us and how can we utilize technology to really allow us to educate ourselves and our teams without a whole lot of lift and kind of fitting into those constraints. So I think for, seeing if we're successful, the patient really says it all. If they're successful, healthier, and they come back and you're able to continue to build those lifelong relationships with them as their trusted pharmacist or technician, then it's a win-win.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we believe that quality measurement leads to better outcomes. Let us become your go-to source for all things related to quality and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. So buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome back to the show. I'm your host, Nick Dorich, and on today's show, we want to dive into the topic of clinical services implementation and patient communications, whether that be through consultations or other patient intervention services related to medication management. Now, earlier this year, the Quality Corner Show was pleased to share that we have partnered with TRC Healthcare, which produces the Pharmacist letter. Some of our episodes are now on their website, and there should be additional updates coming soon. We have some exciting things we are working on together, and that'll be coming down the pipeline. But for today, we thought it'd be nice to have Pam Piotrowski, Product Manager, Pharmacist letter, on to discuss how pharmacists and their team members can improve their skills with these types of clinical services. And Pam, with that, let's welcome you to the show.
It's great to be here. Thanks for having me.
Pam, I'm really excited to have you for today, and PQS and TRC have been working together the last couple of months, bringing our podcast to the Pharmacist Letter website. However, we know that TRC is a tremendous resource for pharmacist educational resources, and I was glad that you agreed to come on the show today and speak about our topic. But before we talk about differentiating your pharmacy clinical services, Pam, can we get a bit of background about you, your role at TRC, and your career as a pharmacist?
Thanks, Nick. I've been a pharmacist for a while now, with most of my career being in community practice and consulting. I worked a little bit in hospital settings during pharmacy school and spent about 5 years in long-term care pharmacy. But for the most part, it's really been in that community practice working with patients. I worked for a large retailer in both the operations capacity, managing up to about 325 locations at one point, but then shifted over into professional training and quality, which I really found that I loved and was really, truly my passion. This passion actually led me to the online clinical training and educational world, which is where I am today with TRC as a product manager. So it's really exciting to be able to affect education and training and just that clinical resource from a broad industry sense for all practitioners and all different types of settings.
Thanks for that introduction, Pam. And as a pharmacist, we always commit to lifelong learning. So that's really important to have folks like yourself that are committed to helping pharmacists with that process. Now we're ready for today's questions, but before we get into them, let's roll to the breakdown.
Now it's time for the breakdown. As Quality Corner show host, Nick will ask 3 main topic questions. Our guests will have a chance to respond, and there will be some discussion to summarize the key points. This process will repeat for the second and third questions, which will wrap up the primary content for this recording. After that, expect to end on a closing summary, usually containing a bonus question. Now that we have described the process, let's jump into the questions.
Pam, we can now go over some of the innovative services that pharmacists have currently been engaging with. Most folks are going to know about medication synchronization or MedSync. They're going to know about medication therapy management or MTM. But what do you see as some of the standard services or interventions that pharmacists can provide as a clinician today?
Yeah, it's been really fun to watch how clinical services have grown within the pharmacy practice. In short, we started with patient counseling on a single medication that grew into MTM services, which really encompassed the whole patient picture. We also found that with MedSync, we were able to kind of help that patient stay adherent and to ensure that they had all the medications that they needed on hand when they needed them without those multiple trips to the pharmacy that sometimes it just didn't fit with their schedules. But now they have so many different options for them to be able to optimize those patient outcomes, like point of care testing, which really helps keep expanding on what we can test. I mean, we've seen that with COVID-19 and how we've really been able to show what we can do. But even to start therapy right then and there, depending on those state allowances. But now we're seeing pharmacogenomics and precision medicine. So we know that the patient will be 100% successful with their therapy without having that trial and error piece. We're even seeing oral contraceptive therapy, expanded disease state therapy centers. The list just goes on. We were even seeing pharmacists build practices within natural medicines and holistic medicines, concierge medicine. So as we think about those gaps in care and how pharmacists are so accessible and often also see the larger patient picture, that now we add in how the state legislators are recognizing the part that pharmacists and technicians can play in improving those patient health outcomes. It's just exciting to see the profession continue to grow in the services that they can provide to their patients.
Pam, as I've been working on some content for future episodes, I think we're going to be covering differences for state practice and how that impacts what pharmacists can do, because it's absolutely right. From my own perspective, coming from the state of Rhode Island, and in general, the Northeast of the United States, we were generally a little bit slower in pickup for clinical services, as opposed to, say, a state like Washington or Idaho or others, Oregon, which has been really proactive and progressive as of late. Before we continue, Pam, I'll ask you another question related to this. And we brought it up from the perspective of pharmacists providing clinical services. And pharmacists are certainly the clinical provider. But there's a lot of support that goes into this. And from your perspective with an education provider, where do pharmacy technicians fit into this? And how are they supposed to learn and find out about some of these services and how they can play a role in supporting the pharmacists that provide the clinical service?
Yeah, and that's a great call out because, I mean, I'm a huge proponent of pharmacy technicians. I mean, as a pharmacist, I'm only as strong as the team that's behind me. So when I think about pharmacy technicians and the role they play, given how busy pharmacy is, pharmacy technicians have a huge role that they can fill in order to help really expedite that clinical service and really enhance that patient interaction. When you think about training that pharmacy technicians can get in regard with clinical services and those patient outcomes, we've seen a huge increase in this. I mean, just from, as you said, from a legislative perspective, think about all the states now that allow pharmacy technicians to provide immunizations. That came in extremely handy when we were thinking about COVID vaccinations and how can we get those vaccinations to patients quickly and to the community quickly. There's lots of opportunity for education, and I think we're seeing educational communities. I know we are from TRC, the opportunity that exists with educating pharmacy technicians. I mean, we've always had Pharmacy Technician University, which really allows pharmacy technicians to gain that initial education for them to become nationally certified and really competent in their roles. But now we're seeing more elite type, like our PTU elite type programs, and we're seeing it across the industry of allowing them even more opportunities to gain expertise in leadership and communication and those soft skills that sometimes they just need a little bit of help with. I mean, we all need a little bit of help with that sometimes, to immunizations, to point of care testing. So it's really exciting to see the offerings really come into play and build to really help pharmacy technicians realize their potential within the pharmacy.
Thanks for that additional response, Pam. And we're going to move now to our second question, and let's talk about staying ahead of the curve. If we go back a couple of decades, a lot of education for pharmacists was about the importance of delivering medication therapy management, or MTM. If we go back to about a decade or so ago, it was about teaching pharmacists about medication synchronization and why they should provide this service to their patients. Now in 2021, most pharmacies have operationalized some form of medication synchronization. They're operationalizing MTM. They're moving towards more point of care testing and expanding what they can do with point of care testing. Really, what this summary goes to show is most pharmacies are implementing these services, and when everybody is doing it, it becomes a lot more difficult to show how you're specialized or how you provide an enhanced service or how you do it better than the others that are also providing that service. So my question to you, Pam, how does a pharmacist improve their skills or improve their care delivery so that they're not just providing these services, but they're providing the most exemplary service for these types of clinical interventions and enhanced medication management services?
Yeah, absolutely, Nick. I mean, what you just summarized is completely on point. MTM seems like such an easy thing to do, but there's often many pieces that we need to really keep front of mind for those interactions to be successful. First and foremost, the sheer communication method is critical. We have to be able to really read the patient and ensure that we're communicating in a way and at a level that makes sense for that patient, that individual patient. And every patient is different. And this not only includes the spoken word, but in body language and how that education is delivered. Speaking with them versus at them, really making them feel like you want to help them versus you're lecturing them. We also need to consider those cultural competencies and even those health biases when we are thinking about these conversations. I mean, the buzzword that we're hearing out there right now is the social detriments of health. So the more that pharmacy teams can prepare and educate themselves and their staff on those types of awarenesses, the more successful that interaction will be for that patient. And I think also from a pharmacist and a technician, the more value they'll get out of it, and they'll feel very competent in how that interaction proceeded and the outcomes from it. I think there's still a lot that we need to educate ourselves on as professionals in this area, and to be proactive in finding that education. It's something we all have to do, and we owe it to ourselves, and we owe it to our profession, and we owe it to our patients to do that. I learn something new every day. And also, when we think about communication from the interaction to be successful, we absolutely can't forget the other members of the healthcare team. We can't work within our own bubble, so we have to make sure that we reach out so we can get those successful outcomes for our patients. You know, patients share differently with each member of their healthcare team. This means we have to share what we uncover with that patient's physician or physicians, but also learn and gain that critical information from them to be able to see that full patient picture. So there's training to be done with that, and there's training out there to really provide pharmacists and technicians with that leadership muscle to be able to get that done and be able to feel confident in those communication pieces. One other piece of the puzzle that pharmacists need to consider is not only looking at the medication profile that we have in our system, but everything else that the patient may be taking that we have to include and be able to make a full impact. So obviously there's education that needs to go into that, natural medicines and those supplements. There's so many supplements and natural medicines out there. How do we as pharmacists and technicians make sure that we're very well versed and we can recognize issues if they bubble up as part of that communication with that patient or just even managing that profile? Sometimes we forget to ask about certain aspects of their therapy, especially these self-treatment and these monitorings that these patients are completing. And that's part of that picture to make sure that they are successful. You'll hear these referred to as CMRs, or those comprehensive medication reviews. So it's kind of like MTM on steroids, but I think it really forces us to make sure that we're considering every aspect of that patient profile, not just what we see in that pharmacy profile. These take into consideration that whole patient profile. So like OTCs, supplements, and herbals, even cannabis and CBD use.
Yeah, Pam, it's a great call out. And the importance, I think, is especially if we're talking CMRs, and that's usually thought of for a Medicare population, right, where patients may be eligible for that CMR. But if we're only doing it that once a year or only doing it when an MTM tip comes up, there's always going to be parts in a patient's everyday life or their healthcare progress that can change. There can be changes to cost for medications. There can be changes to their financial situation, how they're reacting to a medication. So one thing we talk about at PQS quite a bit is that it's a continuous quality improvement process. And for a pharmacist, it's not that you're only doing a service when prompted, but you want to be ensuring that it's done continuously because it is not always constant for the patient. And we need to react. We need to be outreaching with the patient. So when those changes do occur, we're also changing or adjusting our therapy and management with that patient accordingly.
Absolutely. I mean, when we think about it, and that's a great call out, that it's not just a once a year, it's kind of like when you look at your insurance policy and you do that review of your insurance policy, it's every time that you talk to that patient, when they're coming in and picking up their prescriptions, just doing a quick check and seeing how they're doing and really kind of digging in and seeing if everything's going well. Everything may be going well and it's a short visit, but it may open up a window for them to bring up something that they've been concerned about, but they just haven't been able to express it yet. And there's tons of training out there. So, the one piece is that pharmacists and technicians, how do they keep up with everything? So that way they feel confident in answering those kind of on the fly counseling opportunities. And, that training can be everywhere, everything from a simple CE course to, are there opportunities from advanced training modules? So not just a single CE, but a more complex training certificate program out there. One thing that we found that with COVID-19, it really forced everyone to kind of rethink how they receive and deliver their training and education. So it was a real move our cheese moment, but in the end, I think we all came out stronger and we became more flexible of really kind of understanding how distance learning opportunities will benefit us and how can we utilize technology to really allow us to educate ourselves and our teams without a whole lot of lift and kind of fitting into those constraints. So I think for, seeing if we're successful, the patient really says it all. If they're successful, healthier, and they come back and you're able to continue to build those lifelong relationships with them as their trusted pharmacist or technician, then it's a win-win.
Yeah, Pam, thanks for that comment or additional comments. And let's move ahead to our third and final question for the conversation. And we've talked about what pharmacists can do and how they can optimize the services that they're providing. But let's talk about what's new, what could be coming up on the horizon, maybe things that we're not seeing in pharmacies here and now today. Are there any new services that are being introduced that a pharmacist should be aware of, or how a pharmacist can identify details so that they're knowing the right intervention and the right clinical approach to each patient? Are there new updates that are coming around? Are there new data sets that are available? And maybe we could also address the popular topic, and that being social determinants of health. Should pharmacists have or consider data or patient feedback regarding social determinants of health to improve patient outreach and clinical services?
Yeah, I think they're great points. I think the first thing to really consider is as we think about precision medicine and pharmacogenomics. I mean, they've been around for a few years, but I think they're really starting to take hold because we're finding that we can really use that data to really provide strong counseling and strong recommendations to other providers and also to that patient to make sure that they are getting the best treatment that they can get without serious adverse effects, but optimal outcomes from it. So I think that's one of the big pieces that we're seeing a lot of traction now. As far as the social detriments of health, that's another word that's quickly gaining a lot of traction. And I think we're starting to see a lot of additional education opportunities around this area. We've always talked about cultural competency, but it's really so much more than that. Pharmacists often have a window to that expanded patient life picture, such as where they live, where they work, what's their educational status, what do they do for fun, what their family situation is, what their access to healthcare is. The list just goes on and on. We've worked hard to build these relationships. So, this allows us to really use those relationships to find out and really dig in what's going on and how we can really help that patient. We can right now educate our teams on how to play a part in patient health and how we can support them during patient counseling and during those more complex interactions like MTMs and CMRs, or even other, services like when we think about point of care testing and vaccinations. That's an opportune time for us as we have that patient one-on-one to really kind of pull back the pieces of the onion per se and really dig in and find out what's going on with them as a total patient picture. Pharmacy really has an opportunity to play a key role in improving healthcare by recognizing those risks and treating each patient uniquely and having that unique vision inside that patient's life, that we should absolutely use those data points and information to help them improve their health.
Pam, what was really intriguing to me about your answer response was that it was so focused on that interaction with the patient. It's often referenced that pharmacists are the most seen healthcare provider for a patient. And we've covered in previous episodes what we think about that, that yes, pharmacy is certainly the most accessible healthcare site that a patient can access, but it really comes down to what's that actual intervention between the pharmacist and the patient. And as payers are looking to take better control of their healthcare, as payers and other providers are looking to provide better care, the pharmacist plays a key role, or perhaps an underutilized role, in getting more of that information to truly understand what's going to work for the patient. Because ultimately, the greatest medication action plan or the greatest treatment plan for a patient, if it's not in agreement with the patients and with their culture, with their beliefs, with their preferences, if it's not within their spectrum for cost or affordability, that plan is going to fail. And this is absolutely a role or opportunity where pharmacists can play a key role to help optimize the care for patients, albeit maybe in a non-traditional way or one that people have not thought of yet. Well, Pam, this is all great information for today's conversation, and I do want to thank you for your time in talking about effective communications and clinical services and what the road ahead looks like for pharmacy. Now, as we do start to wrap things up, we always like to end our show with a lighter question. And with that, I would love to hear from you about your personal takes or preferences as it relates to travel. This is our go-to question at the end of episodes, and it's always a good topic, especially since travel is starting to happen again with COVID immunization rates improving quite a bit. Now, from your perspective, Pam, what place or places would you recommend based on past experience? And do you happen to have any unique and interesting pharmacies that you have visited in other parts of the world?
Yeah, so travel is definitely increasing, and I'm definitely ready for that. We're big travelers, my family, and we missed our trip to Hawaii. We usually go to Hawaii every 2 to 3 years, and we missed it last year on that rotation. So that's planned for next year, and I'm super excited about that. I haven't had the opportunity to do much world travel because my husband is not a flyer. And so we've done a lot of great places in the U.S. and, of course, our bordering countries. I live in South Texas, so we get to travel to Mexico a lot. And I'm always fascinated by the pharmacies in Mexico and how they provide patient care. I know we always think about folks traveling across the border to find those pyramids of medications that causes all heartburn at bargain basement prices. But I really look beyond that when I visit there because, of course, we always want to go in and see what the pharmacy looks like. But there's always a pharmacist there behind the counter. He's still or she's still counseling and recommending and still building great patient relationships and performing a lot of the same basic patient care services that we do. So I always love to kind of see that linear aspect of pharmacy and how they're so much like us in those other countries. And honestly, I was a little jealous because where they don't have all the dispensing pressures that we do in the U.S., they're having even more opportunity to get out there and talk to patients and counsel and talk to consumers and really see what's going on. So can you imagine if we could just counsel patients all day like that?
It's amazing, Pam. And I know looking at a variety of publications and research, many other countries in terms of scope of practice for what pharmacists can do, it's quite a bit different and maybe a little bit more freeing. I know that's not always the case, but we've had prior guests talk about what pharmacists can do in Canada, how that may be somewhat of a roadmap for pharmacists here in the U.S. When we talked about technicians providing services, what pharmacists can do in Idaho, some of the unique things that they were doing. Some of the first services and immunizations even that patients were getting in Idaho, it was really from actually a lot of patients from Europe and other countries because they went into a pharmacy expecting that a pharmacist could do these things. So I think while we often talk about domestically here in the United States about what pharmacy could do, some of our answers may be actually abroad in other countries as to what the road for pharmacy ahead looks like. Well, Pam, with that, we appreciate you joining us on today's episode of the Quality Corner Show. Before we close, I do want to ask if someone wants to ask you a question about what we discussed today or anything else related to quality, how can they contact you? And in addition, is there anything that you would like to shout out as far as your particular resources, pages, or updates from a TRC Healthcare standpoint?
So TRC, I'm really proud of what they've been doing as far as ensuring that our CE courses are up to date, and we have CE courses that really hit on a lot of those topics that we've discussed today. So we're always looking to improve courses and our course content to ensure that we're hitting on the most current pieces of information that pharmacists and technicians need. We have PTU, which is our Pharmacy Technician University out there. It's a great proponent for pharmacy technician training. We also have opportunities through our RX Advanced and our RX Select opportunities and our products, which provide really more pointed training for pharmacists and technicians and our PTO elite. So lots of opportunity. We're constantly building. I always love to hear from folks out in the field because that's how I determine what everyone needs and how we need to expand. So you can always reach me through the Pharmacist Letter contact page. Feel free to message me through my LinkedIn page. I'm on that all the time, or at Pam Piotrowski, Piotrowski. I know that's a mouthful, at trchealthcare.com. So I always love hearing from colleagues to see how things are going and how I can help in my role. So we're all in this journey together.
Yeah, Pam, it's a great point. I think you and I are very much aligned in this regard. We may not be behind the bench of a pharmacy day in, day out like everyone else is that may be listening to the podcast, but I know from my standpoint, I try to make it a point each and every day, whether it's a work day or a weekend, trying to reach out to a pharmacy contact that I have or that I know to say what's going on, what's new, what's different, how can we really work together to make the world a little bit of a better place for patient care. Now, with that, Pam, again, I do want to thank you for coming on today's episode. It was great to have you here, and you shared some great content. And that does now wrap up our content for today's episode. This episode on effective communications is part of what we're intending as a two-part series, although we could certainly go for many more episodes. And I hope you look forward to next week as we cover another aspect of effective pharmacist patient communications. With that, for our listening audience, make sure you subscribe to our podcast. And if you have a question or topic, please let us know. You can also contact us if you have a topic that you can speak to and would like to come on the show and talk about. We would love that. You can DM us directly on Twitter at Pharmacy Quality, or you can email us at info@pharmacyquality.com. With that, I appreciate you, the listening audience of the Quality Corner Show. And there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.